Today we are going to talk about metoclopramide. This metoclopramide, it's a prokinetic antiemetic agent. The brand name is a Perinorm, which is very popular. It's a prokinetic antiemetic agent and it is a D2 receptor antagonist. It will going to act on the D2 receptor, dopamine receptor. Okay, it's a D2 receptor antagonist. This metoclopramide is having central and peripheral action. It acts centrally also and it acts peripherally also. And apart from that, it also blocks the 5-HT3 receptors. It also blocks the 5-HT3 receptors. Now, as I said, it is having central action, means blockade of D2 receptor in the chemoreceptor trigger zone at a high concentration. At a high concentration, what does it do? It blocks the D2 receptor in the chemoreceptor trigger zone. Metoclopramide relaxes the pyrolic sphincter, thereby enhancing the gastric emptying. Metoclopramide, it relaxes the pyrolic sphincter, thereby it enhances the gastric emptying and it also increases the tone of lower esophageal sphincter. What does it do? What is the central action? By blocking D2 receptor in the chemoreceptor trigger zone, this action is seen at a higher concentration. Metoclopramide, it relaxes the pyrolic sphincter. As you can see in the diagram, there is a pyrolus and there is a pyrolic sphincter. So it relaxes the pyrolic sphincter and that's why it will enhance the gastric emptying. It will push the content of the stomach into the intestine, or it enhances the gastric emptying by relaxing the pyrolic sphincter, as you can see in the diagram. Apart from that, it also increases the tone of lower esophageal sphincter. There's a sphincter, upper esophageal and lower esophageal. So that lower esophageal sphincter tone is increased, right? Now, by virtue of its antidopaminergic action in the CNS, it increases the prolactin release also, because it having D2 receptor blockade action or D2 receptor antagonist. Because of that, in CNS, it increases the prolactin release. There is a release of hormone prolactin. This metoclopramide is given orally in the dose of 10 to 30 milligram per day, preferably before meals. It is given before meals 10 to 30 milligram per day. It is given orally. Now, prokinetic. Why it is called prokinetic? Because it enhances gastric emptying by relaxing pyrolic sphincter and by increasing the tone of lower esophageal sphincter. So, three actions is there. Three actions. First, D2 receptor blocker or D2 receptor antagonist, 5-HT3 antagonist, 5-HT4 agonist. Now, apart from that, it enhances the release of acetylcholine from myenteric motor neurons of the gut. It enhances release of acetylcholine from myenteric motor neurons of the gut. Now, because of these actions, because of these effects, what will be the effects? It increases the tone of lower esophageal sphincter. It increases the tone of lower esophageal sphincter, increases the tone and amplitude of the antral contractions in the stomach. What does it do? Antral contraction will be increased. It increases the tone and amplitude of the antral contractions. Relaxation of the pyrolic sphincter, increase in the peristaltic movement. It promote forward movement of content in the upper GIT. So these are the effects of the metoclopramide. Pharmacokinetic properties: rapidly absorbed after oral administration. It will get rapidly absorbed. It can be given by intramuscular or intravenous route. Onset of action within 30 minutes after oral administration. It is poorly bound to the plasma proteins. It can cross blood-brain barrier, and that's why there is extra pyramidal side effects. Like it causes drug-induced Parkinsonism. Metoclopramide causes drug-induced Parkinsonism. It crosses blood-brain barrier, and that's why there's the extra pyramidal side effects. Shorter half-life of 4 hours, it will get partly metabolized in the liver and excreted in the urine. Now, therapeutic uses, where we can use this metoclopramide. It is used in any type of vomiting, disease and drug-induced vomiting. Because of any disease, if it causes vomiting, you can use this drug. If it is a drug-induced vomiting because of some side effects of drug, so you can use this drug. If there is a post-operative vomiting, prevention of nausea and vomiting of cancer, chemotherapy and radiation therapy. Because of chemotherapy or radiation therapy, if there is vomiting, so you can prevent. If there is a GERD, gastroesophageal reflux disease, acute and chronic gastroparesis, or if there is an intractable hiccup, utski, if it is intractable, so you can use these drugs, metoclopramide. Adverse effect. What will be the adverse effects? Drowsiness, because it crosses blood-brain barrier. Dizziness, diarrhea, muscle spasm, confusion. It causes acute dystonia, and most importantly, because of D2 receptor in the basal ganglia, it causes tremors and rigidity because of D2 blockage. Extra pyramidal symptoms, extra pyramidal side effects. It is also called as a drug-induced Parkinsonism. Tremors and rigidity due to blockade of D2 receptors in the basal ganglia. It also releases the prolactin, so it causes hyperprolactinemia and menstrual irregularities. Hyperprolactinemia and menstrual irregularities in the women's as a side effect because of release of prolactin. On long-term use, Parkinson's symptom and tardive dyskinesia may be seen with the metoclopramide, especially in the elderly people. Now, this drug can be combined with other antiemetics for the management of cancer chemotherapy-induced vomiting. It is given along with the 5-HT3 inhibitors like ondansetron. Metoclopramide should not be combined with neuroleptics as it causes Parkinsonism. Neuroleptics should not be combined with metoclopramide because it can lead to increased chances of Parkinsonism. So this is all about the metoclopramide or Perinorm, which is commonly used drug, but because of various side effects and availability of the better drugs like domperidone, which does not crosses blood-brain barrier and no extrapyramidal side effects, domperidone is preferred, or other drugs like 5-HT3, ondansetron, granisetron, they are better drugs, so we prefer these drugs on this metoclopramide.